Hello everyone. Now I am going to start with my second video for obstetric and gynecology as a career. Right. So there are certain problems with the career. There are certain problems with doctory itself, but I would talk about especially with the reference to obstetric and gynecology. To know this model better, we need to do one example, the example of the field of dentistry. So if you see this graph, it shows that there is a number of dental college against the years, right? So in 1947, that there is total number of three dental colleges in 1947 when we got independence. In 2006, the growth of dental colleges, number of growth were not that much high. So in 2006, there were 95 dental colleges, and then after there was a very exploding surge in the numbers of dental colleges. And if we talk about 2014, there were 301 dental colleges in India. All data I am talking about is India, right? In 2021 again, the number has increased. I am damn sure, right? So this is the reference for this data is there is a study that is available on the NCIM. So you can check the reference link is there in the description, right? Now, if you see about the registered dentist uh, by the year, you can see that in 1994, there were only 21,000 registered dental practitioners in India. 1994. And if we talk about if we talk about 2012, it's just 18 years of period. The number of practicing dentists were 1,20,897. That is around 1,21,000. So you can see that there is a increased numbers of dentists around 1 lakh in just 18 years, right? Same if we talk about that, it is seen that with the experience in the dental field, now we all are familiar with the dental field, right? So it is seen that there is a considerable saturation in the market, and it's not limiting to the only tier 1 and tier 2 cities, but now there is a considerable saturation in tier 3 cities too, right? With this scenario, the job opportunities for the dentist has been shrunk as a considerable point. If you ask a dentist, he will be more uh, suggesting you what is actually going on, right? They are facing real situations where due to lack of job, they either have to invest a lot to open their private or their own clinic, either they have to shift to the peripheral rural areas, or even to change their nature of their job, right? So these are real situations, and I'm not talking anything else. These are real situations. Now look at this. Let's come to the allopathy doctor, MBBS. In 1947, there were 20 medical college. When we got independence, there were 20 medical college producing 1500 MBBS per year. So there were 1500 MBBS seats, right? In 2013, the data shows that there were 350 plus medical colleges producing 45,000 of MBBS per year, right? And if you have a latest figure, let's say 2021, November 2021, that is just 2 months ago, it was seen that there were 595 medical colleges running right now. These colleges including both government and private medical college, right? So they are now producing around 88,370 MBBS doctors per year. So you see the growth of upcoming MBBS seats and MBBS doctors. And with the government of the India now have a policy to open medical college in every each and every district. So in conclusion, what I'm trying to say that new MBBS seats are exploding now. Okay, I know that India as a country, of course, needs more and more doctors to improve our system, because India is considered as a desert for doctors, right? Because there were very less doctors to a certain amount of population, and doctor to population ratio were very high in those times, or you can say low on those times, where one doctor was available for around 1 lakh of the population. But now the situation has been increased, and some state like Maharashtra have now surplus doctors. That means the ideal ratio of 1 to 1000, that means one doctor should be there, one MBBS doctor should be there per 1000 of the population. This ratio has surplused in states like Maharashtra and Andhra Pradesh. So to be said, that to be considered, it is actually a good thing for our country, good thing for a population, because more and more people now have a doctor if they get a problem in their life, right? So it's a good situation, no doubt in that, and it should be like that only, right? Doctors should be increased, and still I wish for the government that they will increase more and more medical colleges, so that we can get more and more doctors. But uh, the problematic situation start now, because after becoming an MBBS, or after even passing the post graduation, what next is the main problem. Okay, because there are lesser and lesser opportunities for the young doctors, right? Because market saturation is a time tested time tested concept, right? As we have seen in the dentist, it is time tested. So I am sure that this situation will come to our field also, that is of allopathy medicine, and this is imminent, no one can stop that. So market saturation will be there in, I think, next 5 to 10 years. This is imminent, right? This is also true about the obstetric and gynecology field. That is our field. Gynecs or obstetrician these days needed to be more and more equipped with the latest skills and advanced knowledge. Because in the situation of market saturation, to be in market or to be in the picture, you must be having certain sets of skills, as I have discussed in my previous video, right? So again, what I'm trying to say, that yes, this is good, increasing doctors, it's a good thing, but it invites the situation called market saturation. So to compete, to prepare for this situation from right now is a need of an hour. Okay, we have to be prepared for this situation in next 5 to 10 years. And previously what was happening, that the growth of our career was slightly slow, right? But now what happening, now the situation is there that we need to boost ourselves and push ourselves to get more and more new and latest techniques and new sets of skills and advanced treatment protocols in our basket, right? We can't afford more and more time. Okay, we can't afford more and more time that we used to be in past to acquire the latest treatment and surgical procedures. For example, if I say a postgraduate passed out, now after that post graduation, that candidate, that gynecologist will again practice as a senior residency for 3 years, and then they will be going actually for a consultations and a consultant level practice. But now the situation has been changed. Now let's come to the financial aspects. Before starting, I want to make sure that, and I want to assure you that we as a doctor, our first priority or highest priority must be the patient's interest. Right? There is no, there is, there is nothing lack of interest that we can afford. Okay. Yes, financial aspects are on their space, but as a doctor, we must have our priority to see or to help in the patient interest. There is something called good medical or good clinical practice. There are four domains of that practice. First is knowledge, skill, and performance. Second is safety, patient safety and quality. Third is a communication, partnership, and teamwork. And fourth is a maintaining trust with the patient. So this clinical practice is must to follow for every doctor, right? And if we talk about knowledge and skill and performance, then we need to think that patient's care is our first concern, must be our first concern. Okay, now let's go for the financial aspect of obstetrician and gynecology part, right? So in general, if I talk about general obstetric and gynecologist or an average obstetric and gynecological practice, there are three different aspects of income. The first one is OPD, that is outpatient department. The second one is a surgical procedures, and the third one is a IPD, that is inpatient department, where you admit the patient and patient are admitted in the ward. So the revenue comes from these three departments, right? In the OPD department, it is generally seen that 10% of the income comes in a set of in from the OPD. 50%, that is a very large bulk of income, is generated from the procedures, right? And the procedures include what? Obstetrics and gynecological both. For obstetrics, vaginal delivery, maybe a assisted vaginal delivery or cesarean section, and for gynecology it may be hysterectomy or pelvic surgery, like that. In inpatient department, another 40% of the revenue is generated. So overall, if you see the field, more and more income is generated from what? Operative procedure department, right? And these patients only which you have admitted for surgery will eventually go for a inpatient department, that will be admitted into the ward. And so what I'm trying to say that operative procedures makes a large bulk of revenue for obstetrician and gynecologists, right? Now if you compare obstetric procedures and gynecological procedures in your setup or in a general setup, then you will find that in obstetric procedures, what we do is vaginal delivery, assisted vaginal delivery. That is not specifically an operative procedure, but let's say for this instance too that yes, this is a simple operative procedure. Cesarean sections and dilatation and evacuation. For gynecological procedures, we have hysterectomy, that is done by three routes: laparoscopic, abdominal, or vaginal, and various adnexal surgeries that includes ovarian surgeries, tubal surgeries, etc., etc. Like so, if you see about the case load of the patients, so generally what is seen that 10% of the population undergoes, female population undergoes cesarean section, right? 6% of the female population of 35 to 50 years of age generally undergoes hysterectomy. These data are taken from the various references, right? And references are are there, links are there in the description. Now if you see the nature of both procedures, the obstetric procedures are in nature of emergency procedures. Most of the procedures in obstetrics are in the emergency basis, right? The complication rate is slightly higher, and then that's why the legal problems are more and more with the obstetric practice. I know what I'm saying, this thing you already know this thing, just I am remembering you that yes, what the things are going on. Okay, 6%, where you see gynecological procedures, they most of those procedures are routine one. They are not emergency procedures, and they uh, they tend to have a lesser legal problems associated with them, right? I want to tell you one thing also. Do you know that laparoscopy, which is a very famous famous uh, famous surgeries. I mean, laparoscopy is which is a very famous type of surgeries that are done: laparoscopic cholecystectomy, laparoscopic hysterectomy, laparoscopic cystectomy, laparoscopic appendectomy. All the laparoscopic nature of the surgeries. Laparoscopy was invented. Sorry, laparoscopy was invented for gynecological procedure itself. So, if you go by the history, laparoscopy, which is done by all the surgeons right at present, was invented basically for gynecological procedures and not for routine surgical procedures like cholecystectomy and appendectomy, right? So, laparoscopy is basically our domain, an obstetrician and gynecological domain. It is seen that many general surgeons who are practicing, large bulk of their practice includes gynecological surgeries only, that is hysterectomy and cystectomy, like that. There is a very infamous tag that the gynecology field being a female leading branch and the female are less competent for surgeries. In the age where females are reaching at every field and they are exploring space now, with this kind of uh, females doing big and big things every day, and we have this tag associated with us, right? So I think there needs to put an end on this situation. We as a gynecologist must acquire surgical skills, and we should start acquiring these skills as early as possible. It's not like that you will practice for 3 years, you will practice for 5 years, and then you will get your first hysterectomy, right? And then after 3 4 years more, and then you will become competent in hysterectomy. No, it's not like that. Now we can't wait for that period amount of time, right? Because I already told you there will be a market situation imminent, and in this kind of scenario we can't afford to waste time, and we can't afford to wait more and more for these opportunities, the surgeries that we do, right? So on conclusion of this video, what I'm going to tell you that young gynecologists who are just passed out or who are pursuing their career in post graduation must consider themselves to get ready for gynecological operative procedures in lesser time. Right. Scopes of the learning GOP, that is gynecological operative procedures, is limited. Is limited. Everybody knows that in post graduation, a student gets hardly one, two, three, four of gynecological surgeries, and we know that. Even in senior residency, it is hard to get an abdominal hysterectomy independently in most of the clinical institutes, training institutes. Isn't it true? It's true. So even early year of practicing, even people who just have done their SR-ships and then join the medical colleges and they are assistant professors, even these strata, even these groups don't get sufficient amount of cases to learn and to master their skills. So with this situation, I'm going to surprise you with a rescue. Here we come for rescue, right? What we are trying is we are trying to collect all these procedures or these training protocols, and we need to provide and we need to make it available for the upcoming students who are pursuing obstetrics and gynecology, or who are doing their senior residency, or who are even practicing but have a lesser confidence in their surgical skill. So we are keen to provide you an opportunity to learn the surgical skills as quickly as possible and as justifiable uh, as much, right? So we are arranging a hands-on hysterectomy workshop, and the key points of that workshop will be that you will be personally assessed by your trainer, that how much how much do you have uh, skills, surgical skills, right? And how you need to improve that skills. There will be individual prepared training schedules in which you will be given proper amount of theoretical knowledge throughout and pelvic anatomy, followed by hands-on at our centers, right? The surgeon will be the surgeon you will be assisting the surgeon, and if you are found competent and if you have completed your degree, you will be given proper hands-on, right? Followed by certification of the course. So this is, I think, a very good opportunity to learn hysterectomy, which is a very basic surgery for our day-to-day life of a gynecologist. So if you lack your skills in hysterectomy, the link is given in the description. You can go there and you can register yourself. Registration is free, there is no cost. You will be assessed by the trainer, and then if you think that it is good for you, you can go ahead with the course. This is all about this video. Thank you, friends.